It's such a personal experience every time we go. It's like she's a neighbor or a friend rather than a clinician at times. It's just a relief knowing that, number one, if we need to see a medical person, we don't have to wait a week or 2 weeks or 3 weeks. We have been fortunate we've been able to get in within a day at the longest. And they're local, they're close to home, and we never feel that we're rushed or that they're brushing us off. It's just been a really positive, good thing for us.
It's not just a primary care provider, it's a whole team of great people who help me in a variety of areas. I think that this model is excellent. I think in some ways it should be more prevalent and more available to the public, and I think it would foster outcomes that would be in the public's best interest.
They listen to me, to my troubles, what's going on with me. None of them have ever jumped to the conclusion of, oh, this is it, this. They've all listened to what I had to say. They have all treated me very well. Through my bad experiences within myself, they've been able to give me a quality of life, and without the clinic, I would not have a quality of life.
We're fortunate that we have the time to spend with our patients. We can spend a little bit more time than the average provider. So we're able to deal with a few more issues at the same time, and we have access. We're lucky that because we have a team-based approach, you know, if somebody needs to see somebody like the dietitian or the social worker, sometimes it's just a matter of walking down the hall and saying, can you see them right now? And we're lucky that we also meet on a regular basis and do grand rounds. So we meet and we talk about our difficult cases and we get everybody's perspective, because sometimes it's, you know, maybe you think you've gone as far as what you can in our scope, and then you think by bringing it to the team, they're able to give a different perspective and say, how about you try this? Can we try that? So we're very, very fortunate that we're able to do that. So our patient council is a council that we founded about 1.5 years ago. We wanted to get feedback from our patients as to how we're doing. What are we doing well? What are some areas that we can improve on? We have to submit data to the Health Quality Ontario every year as well. So we wanted to get feedback from our patients to say, what's important to you? What are the things that we should be capturing from your perspective to show the ministry how well we're doing?
Getting the model across to patients who thought it was just a band-aid solution to the problem, not realizing what the full scope of a nurse practitioner was. So thinking that they were going to come here until they could find a physician was a real obstacle at the beginning. But better education, more NP clinics, people are understanding what the program is now. The scope of the nurse practitioners and the other staff, since I've been here, the RN scope, the scope for the pharmacists have increased since we started, so they can handle more and more and more issues. That's great for us.
Nurse practitioners no longer have a list that they can that they have to use to prescribe or to order lab work. With that list opening up, we're really able to work to our full scope of knowledge and not be dependent on contacting a physician to renew a medication, for example, when we have the knowledge and the skills to do so ourselves.
The clinics are very important because, especially initially, the clinics took on patients that nobody else wanted. So these were patients that had been either derostered or had not received care for many months and years. And so in the early going, we certainly took on thousands of patients that hadn't had care in many years. So there was a lot of diagnosing of illnesses, of conditions that we were able to provide care for.
I think not only was it important because there were unemployed nurse practitioners in the area, so it gave people jobs, but on the other hand, it also was an opportunity for nurse practitioners to work to their full scope of practice and to be able to be the primary care provider for patients, which isn't the case in some other models. Well, I'd like to see it expand. I'd like to see this particular model expand in the Sudbury area, but I'd also like to see additional nurse practitioner-led clinics in the province of Ontario and perhaps across the country.
I would say that to this day, the nurse practitioner clinic model has benefits that some of the other models of care don't.
It's very extremely effective when it comes to fostering well-being and fostering healthcare in the province. So.
With the clinics' help and understanding, our quality of life is good.
Go for it.
Awesome.
It's a great way to experience medical attention, and I said there's no negative